Coming up on Mayo Clinic Q&A.
We could
Mhm.
have really impacted their quality of life, impacted them lessening from dying from heart disease, and we're too late on some of these issues. That's my biggest fear coming down the road.
Due to COVID-19, many people delayed or canceled scheduled healthcare checkups and screening appointments. But delaying or not getting that timely care could have serious consequences.
Even if they haven't received a vaccine, I would still not delay care, especially if they're having warning signs of heart attack, worsening or new heart failure signs or symptoms, shortness of breath. I would still recommend those patients come seek care anyways.
Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. As we have shared before in this program, an unfortunate consequence of the COVID-19 pandemic has been people delaying necessary health care. Some may have felt that it was too risky to go to the doctor's office, but ignoring warning signs and symptoms can have long-term consequences. For patients who know or suspect that they may have a heart condition, this can be particularly important, and it's crucial to understand when one needs to seek emergent or non-emergent care. Well, here to discuss this important topic today is Dr. Christopher DeSimone, cardiologist at Mayo Clinic. Thanks for being here today, Chris.
It's my pleasure. Thanks, Dr. Gazelka, for this opportunity. And I really hope we can dispel some myths or at least give patients a really good sense of comfort to come seek care when they really need it. Because I really think this is something where we could help patients, especially if they wish to seek care sooner, and we could provide them better care in a more expeditious fashion.
Well, I'm really looking forward to that too, Chris, because this is frankly sort of amazed me, and you're not the first physician who's mentioned this on this program. And I've even talked to colleagues in the emergency department, and they said the same thing, that people were not seeking care. So tell us what this has been like in your practice. What have you seen?
So, especially on the hospital services where we see patients that come in through the emergency department or from even more dire circumstances in through the intensive care unit, we see that the patients, and rightly so, they've been afraid of contracting COVID-19, and they know patients with COVID-19 are hospitalized. So it makes sense that they have this sense of fear, and it's kind of delayed them from coming in, even if they were having chest pains or early warning signs of a heart attack, worsening heart failure, new heart failure, bad arrhythmias, awakenings of prior arrhythmias they've had, all sorts of things. And really their fear was to come in to seek care from getting COVID-19 in the hospital, which is understandable.
Yes. Yeah. I mean, with all that we have seen on the news about people dying and bodies being stacked up, you can see why people would have fears. But now we're getting vaccinated.
Yes.
So should that fear be the same? I mean, we're trying to dispel that myth anyway, but once someone has been vaccinated, they've had maybe one of their vaccines. If they're going to have two, maybe they've had them both. What would you tell them about seeking care?
Well, that's a great point. But I would even take a step back and say, even if they haven't received a vaccine, I would still not delay care, especially if they're having warning signs of heart attack, worsening or new heart failure signs or symptoms, shortness of breath. I would still recommend those patients come seek care anyways. The bonus now is with so many of us being vaccinated in the hospital, as well as outside of the hospital, I think if they had one shot or even two, all the more so not to delay their care.
And Chris, you see patients with heart disease. You're a cardiologist, obviously. And what do you think, what do you see down the road after the pandemic as far as in cardiology clinics and the patients you might see? What do you predict?
My fear, and I love taking care of patients, and all of us as physicians, you, me, all of us, all of our colleagues, we really love making patients feel better. And really heartbreaking is things we could have offered patients, medicines, interventions, things that if we would have caught in an early time frame, we could have really impacted their quality of life, impacted them lessening from dying from heart disease. We'll come to a point where we might have waited too long and we're far out of the barn, and we're too late on some of these issues. That's my biggest fear coming down the road. And what that will lead to is either we can't offer them these life-saving treatments or quality of life improving treatments, or the surgeries or interventions will be much, much higher risk because they'll have issues where if they go under anesthesia and have surgeries, they're going to be a higher risk candidate. So they'll have not only heart disease, but because their heart's not pumping effectively, they might have issues with their lungs, kidneys, which makes everything much higher risk. So that's really heartbreaking to me, and I hope I don't see that, but I have the sense of what I've seen on the hospital services that that might be more and more of the case.
That's so interesting, Chris, because we have had some oncologists on the show saying the same thing about cancer care, that patients have been delaying, and that causes them perhaps not to even be able to have the same surgery or the same chemotherapy or the same treatment that they otherwise might have had because they're presenting at a later stage in their disease. And it's interesting that that's true of the heart as well.
Very true.
So, Chris, what are signs and symptoms that should bring someone in? I think we all have this, fear of not or reticence maybe sometimes to seek care, thinking, oh, this isn't really important. If I just wait it out, if I wait another couple hours or wait till tomorrow, this will go away. I'll go lie down for a while. What are the types of symptoms that should really cause anyone to seek medical care?
Definitely. So I think new symptoms, something that they can't explain before, would seek someone to seek medical care regardless. That could even be something like COVID brewing anyways. That's kind of one of the manifestations. But I would say, of course, chest pain, chest tightness. If someone's had unexplained weight gain, a lot of the patients that I've seen that have developed heart failure and they said, well, I've gained 30 or 40 pounds in the last couple months. I really haven't changed my eating habits, or I really haven't ate much more, but I just haven't been exercising because I'm afraid to go outside. That might be signs that, weight gain unexpectedly that quick could be you're building up fluid from heart failure.
That's
So I
an
think,
interesting one. I never thought of that, Chris. That's
yes.
really...
And also if you're having, heart palpitations, if you feel your heart racing, if you feel lightheaded, if you're feeling dizzy, if something's not right, I think those three big things, and those land in the areas of heart attack, those land in the areas of heart failure, those land in the areas of heart rhythm abnormalities. I think those would be the big three things that said, listen, I need to get checked out. If it's my primary care, if they could at least get an EKG and assess me. If it's the emergency department, I would not delay care at all. I beg our patients not to delay any of those signs.
And what's so interesting is that some of the symptoms that you just described can happen with anxiety, for instance, and during COVID, certainly. I don't think any of us are immune from anxiety,
Agreed.
but concern about anxiety should not keep someone from seeking care to be certain that it is not their heart.
Agree completely. And also I would offer some really strong words, I think personally, of advice. My brother's the physician here, Daniel DeSimone, an infectious disease. And we talk about this all the time. We feel the most safe when we're in the Mayo Clinic building, when we're in the Gonda building, when we're in St. Mary's, and we're on the wards all the time. And we still feel most safe. I take care of patients with COVID. He's always taking care of patients with COVID. We still feel the most safe when we're in the hospital. And why is that? There's been a critical mass of our patients, our providers that have been vaccinated. Also our patients as well, especially locally. But lots of people at Mayo Clinic have been vaccinated. But even more so, we've been to the taking every precautions necessary. So masking, I'm not wearing one now, but I'm in a room by myself. But as soon as I leave the room, I have a mask on, as well as eyewear. That's all across the board. So that's all the time. Everyone's wearing it. Everyone's looking out for each other to make sure everyone else is wearing it. So I think that the use of N95 masks, especially in the surgical areas, all of that's been very restricted. We have fantastic ancillary staff that have been checking people at the doors, asking the proper questions. So I feel more safe in the hospital than I do when I first walked out and I started going to department stores with my wife and shopping with my wife, who loves shopping. I was almost scared, not scared, but I was almost much more worried when I was going to those type of places than to the Mayo Clinic.
I agree, Chris. And it's fascinating because now you see in all of the stores when you walk in that they have hand sanitizer out to use and warning signs and things. And of course, we've always been obsessive about hand washing and cleanliness in the
Yes.
hospital. So there is an element of safety that has always been there, but also a really heightened awareness of how we need to manage patients appropriately. I work in the pain clinic and we space our patients apart, even in the waiting room. Chairs are marked to be left empty. They, distance in the lines. And so we've taken a number of measures to make it safe to come here.
One patient actually told me earlier this week, she had come to get an ablation a couple months back, right in the heart of the pandemic. And I was seeing her in follow up because I really enjoy seeing my patients and seeing how they're doing. And she was feeling great. She said, "Oh, all of my family members and relatives and friends were saying, oh, you went to the hospital in the right of the heat of the pandemic." And she goes, "I felt safer in the hospital than I did anywhere around anybody else or anywhere else." So I think that's a testament to Mayo Clinic. And that made me feel real good that, we really want to do what's best for our patients. We really want to keep them safe, and we'll go to
Yes.
any means and measures to do that.
Now you've made our listeners curious what an ablation is and what it has to do with the heart, Chris.
Yes, of course. So what we do for ablations in broad strokes is some areas in the heart, everyone's heard of or seen these commercials about atrial fibrillation or the heart beating irregular. There's some areas of the heart that have abnormal tissue, and we're all born with this. Some people, it wakes up and is angry, and some people never becomes a problem. And we could go up through the groins, and it's invasive but not open heart surgery, and we bring small catheters up into the heart, and we could map where these electrical rhythms are coming from, and then we use radio frequency to heat and kill off the tissue.
So that patient that we mentioned earlier that might be worried they're having a panic attack, or that it might be their heart, might have an arrhythmia or a difference in their heartbeat that's faster or irregular, that might be a person you would do an ablation for at times.
Absolutely. So it's funny you mentioned that. We've done a lot of this telemedicine, which has been fantastic.
Yes, I was going to ask you about that.
That's our first touch point for patients. So patients all over the country. And, there's been a lot of, I think, bottlenecking of care in certain places because they're not maybe as fortunate as we are here at Mayo to have all the resources and all the excess openings that we have to get patients in expeditiously. And telemedicine has been a great savior in this regard. So we need patients to be seen, and there's lots of them, but they might have fear of coming in, or they might not need to travel, which is completely understandable. And we've done a lot of telemedicine, telehealth visits, either video or even phone calls. What are your symptoms? What have your rhythm strips been at home? Should you make the trip to Mayo Clinic to where we could provide an ablation to provide you better care? And that's been fantastic. And some of the patients, interestingly, you said about the anxiety, they were told they had anxiety. They came to the emergency department locally. They've gone to their primary care locally. EKGs, everything's normal. It's anxiety. But then many patients, I've said probably a dozen at least, I've had them do these monitors where they could wear what we call them Holter monitors. So they record what the heart's doing during these periods of anxiety, and they've been arrhythmias. So we've bring them back, especially the last couple months. We've done the ablations and we've kind of cured their anxiety. And funny thing is, the anxiety about that makes the heart arrhythmias worse. So it's really been great to provide them a much better quality of life and relieve anxiety as well as any heart issues they've had.
Well, that is really interesting, Chris. I have to say that there are so many things that have amazed me about COVID, but as far as being a physician, one of the most amazing has been this use of virtual medicine and seeing people over Zoom, quite frankly, is how we do it here at the clinic. And being able to extend our services out to patients who may not be able to travel here right now. And I find that particularly fascinating in cardiology, because that isn't necessarily an area I would have thought maybe you had to be right there to examine the patient. So it's really interesting.
It is. And I'm a mama's boy. I'm a grandma's boy. I'm a hugger. I like to shake.
Here.
I like to shake hands. And I thought, no way telemedicine's going to work for me. I need to see my patients. I need to be able to examine all that. But it's been really a blessing because I've been able to reach out to more patients, and the patients that don't need to come and see, then I've been able to provide reassurance, which is great for them. The patients that do need to come, I've been able to expedite and get them in sooner. So to me, it's been a win-win all around.
I've been a resistor. I was a resistor originally too. I was very skeptical, Chris, because I too like human contact and I like to be in the room with the patients. And I felt like some of the rapport wouldn't be the same if I couldn't, touch them and actually speak with them in person. But what has been really neat is not only can you see initial consults this way, but when I have seen a patient in the clinic and they go home and I want to check in with them. They used to send me a portal message. Now we can do a virtual visit and I can actually see them and see whether they're improving. So I think it really is, it's been really one of those silver linings of COVID.
It has. And it saves them, a 14-hour round trip driving. 2 days of travel, flights, so I think it's been great.
So Chris, I have another question for you about vaccinations. It seems that most people are eligible to have a COVID vaccination if they're adults and I guess it's greater than 16 years old now. But are there heart patients who shouldn't have COVID vaccinations, or should they go ahead and get them?
I'm so happy you asked that question. So I get at least 5 or 6 messages inboxes every day and several phone calls, several text messages from some of my patients. I tell them, and I've consulted with my brother as well in infectious disease, so we're on the same page and I know I'm telling them the right thing. So one thing is, I don't see any reason that a patient should not get it. In fact, I encourage them. And then their next question is, well, which one should I get? And my answer is always the first one they offer you. So I think they're all tremendously efficacious. Now, patients, those certainly might set off certain things because patients with heart issues are prone to more heart issues or heart arrhythmias, things like that. So what I tell the patients is do 2 things. One, a couple things I'll share with you. I tell them, one, always have someone with you. So if I have a husband and wife, I say, okay, have the husband get the vaccine day 1. Next day, the wife gets the vaccine, or vice versa. Actually, I tell them get the wife vaccinated and then get the husband first. Because and then this way you have one person that's able to drive with no issues, and you have a backup safety plan the next day. Then what I say is, if you don't have a ride or you're by yourself, tell them, if you were to go to a pharmacy or one of these places, say, I'm a little bit concerned, I have some heart troubles. Do you mind if I get the shot and hang around for 30 minutes? Because that's when the severe anaphylactic or something concerning might happen. And then that gives them a sense, it's like a crutch to give them a sense of, look, someone's going to be here watching me for 30 minutes. After that, it'll be safe. So I've told all my patients to do that if they have any concerns, but never have I told them not to get it. I really think they should get it. If they have a heart problem, even more so get the vaccine.
I was so glad to hear that. And 2 of the things that you said really struck me. One was that most allergic type reactions or negative reactions to the vaccine that are serious or significant happen within the first 30 minutes. So people are going to know. Side effects, that may take a little bit longer. And the other thing you said was that all of the vaccines are efficacious. And so people should accept the one that they're offered. Here at Mayo Clinic, we have immunized our employees with all 3 of the vaccines that are currently available. And it just depends on what day you went to get your vaccine.
Exactly. The DeSimone family, poster child. Some of us have gotten Pfizer, some of us have gotten the Moderna, some of us have gotten J&J. All are perfect. So I'm telling my only family members this, so is my brother.
That's great. Anything else you'd like to share with our listeners today, Chris, before we go?
I would say to the listeners, to our patients, future patients, our patients that have been here for a long time with us, please contact us. Even if it's a phone call, we're happy to chat with you. We're happy to chat with you via our inbox services through Epic. Do not delay care. We really want to help you. We really want to be able to intervene and improve your quality of life. Do not let something that could harm you, really harm you out of fear, which we understand, but will help alleviate and mitigate as best as possible. Please, we really want to take good care of you.
That's wonderful. Thank you, Chris, for being here today.
Thank you so much. Thank you for giving me this opportunity. And I love my patients, and I really hope this will help put their mind at ease. And I really appreciate, Dr. Gazelka, this opportunity, because this will make my heart feel much better. My heart itself.
Yes, your heart. And Chris, I bet that your patients love you too.
Oh, Thank
I
you.
would be happy to be your patient. I'm glad that I don't have to see you, but I would be very happy to be your patient too.
Thank you so
Thanks
much.
for being here.
Okay.
Our thanks to Mayo Clinic cardiologist, Dr. Chris DeSimone, for being here today to talk to us about receiving health care and heart care, even during the pandemic. I hope that you're not delaying your care. If you are, now is the time to think about being seen and reporting to your doctor. Thanks for being here today. I hope that you learned something. I know that I certainly have, and we wish every one of you a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.